Hi everybody, I'm going to be doing my disease presentation on Menieres syndrome. I'm going to be talking about some signs and symptoms, what it is, and some treatments we can do. So, what is it? Before we get into what the definition of Menieres disease and syndrome is, we need to talk about one underlying fact about it. So, the difference between Menieres syndrome and Menieres disease is pretty much the etiology is known for Menieres syndrome. What that pretty much means is we know what caused it. So if you know what caused Menieres disease, it's not technically called Menieres disease, it's called Menieres syndrome because you know what caused it. Menieres disease is pretty much you have these signs and symptoms, but we don't really know what caused it in the first place. So that's the difference between the two. But other than that, they're pretty much the same thing. So Menieres disease or Menieres syndrome is an inner ear disorder involving recurrent and prolonged episodes of vertigo with other associated symptoms, which we will get to in a minute. It affects the semicircular canals, which is up here in the top right, and the cochlea of the inner ear as well. It accumulates endolymphatic fluid, which builds up pressure in the ear, and you can see why that would be bad. It can occur at any age, but usually starts between young and middle age of adulthood, and it affects around 500 to 100,000 people. Some triggers that can cause it is high salt intake, alcohol, smoking, stress, and genetics. So some signs and symptoms. So Menieres disease is progressive, meaning as the longer you have it, the worse it gets over time, and is often unilateral. This means pretty much it usually happens on one side of the ear brain. There are some cases where it happens on both sides or over time, like it starts off on one ear and then it goes to the other ear. But for the most part, it's always unilateral. So, vertigo, what is it? It's a spinning sensation, even when motionless. It often happens spontaneously and is reoccurrent. It is the first symptom that occurs during an episode. Vertigo can last up to 30 minutes to multiple hours at a time, and can cause nausea and vomiting, which could also lead to dehydration if severe, and falls. So vertigo is pretty much what this picture in the top right is showing. You see, as you're sitting, the room around you starts spinning and spinning, and it doesn't stop, and there's nothing you can do to stop it. It's like if you ever went to Six Flags and got in the teacups, when you're rotating, you start spinning the wheel in the middle to pretty much get you to spin, and once you get off of it, like you kind of like whoopty and you're kind of like unbalanced, and it feels like you're still moving. And that's what vertigo is, and you can see why that would cause vomiting and why it can cause falls as you try to get up. So, some more signs and symptoms. These two are special cases, as this hypo and hyperthyroidism can cause Menieres disease, and so can syphilis. So, what is hypo and hyperthyroidism? So, hypo being underactive thyroid hormones, and hyper being overactive thyroid hormones. Some things you can get with hypothyroidism is fatigue, sensitivity to cold, dry skin, muscle weakness. Some things you can get with hyperthyroidism is weight loss, fast heartbeat, palpitations, which is pretty much like really hard, like like your heart is pounding, and anxiety. And in this bottom picture right here, we have just some more information about hypothyroidism and hyper, like cold, weight gain, constipation, muscle and joint pains. And then for hyper, we have diarrhea, muscle weakness, anxiety, and more things. And syphilis is a bacterial infection. It can cause rashes, a mild fever, sore throats, muscle pains, and headaches, and many more symptoms. This is just a picture of somebody who has rashes on the palm of their hands, and this can also spread to like your genitals, your chest, your back, legs, pretty much anywhere. But these two cause Menieres syndrome, rather than you have Menieres syndrome and this is what comes with it. Some other signs and symptoms of Menieres disease is tinnitus, which is ringing of the ears. This is described as like a white noise in the back, like in the background or something. Like you hear like ringing, or like sometimes you can hear low tones, etc. Like just like some noise that never goes away. And again, it's all unilateral, so on the ear that's being affected. You can also experience hearing loss in that ear. Hearing loss in the sense of like different frequencies. It may be harder to hear like a certain frequency, or a lower frequency, or a higher frequency, maybe. And over time, it may become permanent. That's the one thing you got to remember about this disease, as the longer you have it, the longer the effects can be, and the worse it can get. You can also have ear pressure, so like discomfort in your ear. Ear feels full, like something clogged it. Like when you go on a plane, as the altitude rises, your ear kind of gets like muffled and clogged. And that's one of the symptoms. So what are some treatment for Menieres disease? So Menieres disease can usually be controlled with medication or dietary changes, like having a low sodium diet can help. If this doesn't work, gentamicin injections, which is a treatment for fighting off serious bacterial infections, can help. It might give some lasting relief. If this all doesn't work, surgery is also an option. Just you would have to talk to a doctor and see what the best course of action would be for you, because every case is different. So some other treatments is diuretics. It's a long-term medication, which is also the most commonly prescribed medication for Menieres disease. It works by restricting the overproduction of fluid in the inner ear. Diuretics helps reduce the number of vertigo attacks and sometimes stabilizes hearing. So, Menieres is a commonly prescribed medication to control vertigo. So, it is an over-the-counter medication. So I'm sure you can get it in your local Jewel, Walgreens, and it controls nausea and vomiting and dizziness. So again, like it kind of like minimizes, but doesn't completely take away the spinning of the room and vertigo, but like it helps control it to a certain extent. Again, you probably talking to a doctor would probably be a best course of action. So this concludes pretty much my disease presentation on Menieres syndrome. So a couple quiz questions I have here are: what is Menieres syndrome and Menieres disease? Like, what's the difference? What specific part of the ear does it affect? What are some triggers? What are some signs and symptoms? How do they affect you? What are some treatments? How does it help/work? What drug is over-the-counter medication? And symptoms of vertigo. So you can go back and replay the video and probably get some of these answers. Thank you.